Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters. Hello, everybody, and welcome back to the Her Story Circle. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating guest. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
I'm Dr. Robert Freedman. I'm a psychiatrist, a professor of psychiatry at the University of Colorado School of Medicine in Denver, Colorado, in the United States. I was interested in research in mental illness from the very beginning of my career because I recognized that as a psychiatrist, there were many people whom I could not adequately help who had the most serious mental illnesses: schizophrenia, bipolar disorder, autism, and attention deficit disorder. Research was showing us several things about these disorders. First of all of them can be traced back to what happens in pregnancy as the baby is trying to develop its brain. And second, most of these illnesses have a strong genetic component. And what the genes seem to be doing is that they are affecting the way the brain develops. So very small cracks in how the brain develops in its very foundation, which are part of the brain development before birth, after birth, eventually become manifest as mental illnesses. In childhood, for some mental illnesses, not even until adulthood for other mental illnesses. One of the genes we discovered is a gene that normally responds to a chemical called acetylcholine, and it also will respond to nicotine. So it's called a nicotinic acetylcholine receptor. Before birth, the way this receptor is activated is by choline, and choline is a nutrient that mothers take in their diets. They're able to make a little bit of choline, but most of the choline comes from their diets. And in looking at research around the world, I realized there's no country in which women get adequate amounts of choline while they're pregnant. In other words, over 90% of women in Australia, in the United States, in Canada, throughout South America, and in Africa have inadequate intake of choline to optimally develop their baby's brain. Now, it may seem to you rather remarkable that a nutrient might have effects on how the brain is developed sufficient to change the course of whether a mental illness develops or not. But we do have a precedent. Many women in most countries of the world take folic acid as part of their prenatal vitamins. And folic acid is able to prevent spinal cord defects. The spinal cord is half the nervous system. The other half is the brain itself. And it seems that folic acid and choline together can enable a baby to avoid some of the problems that lead to later mental illness. And so we and researchers other researchers in the United States, as well as researchers in Ukraine and in South Africa, have found that by giving extra choline to women, we are seeing babies who are better able to pay attention and who are better able to make friends and also better able to bond with their parents. And these three key ingredients are a pathway to better mental illness, to better mental health, rather. They're a preventative against mental illness. And so the reason I wanted to join this podcast, and I'm grateful to Gertrude Mechi for making this possible, is that I want as many women as possible to know about choline, because choline is not a prescription. It's something that you can take in your diet. You can eat it in eggs and meat, and in soybeans if you're a vegan or a vegetarian, but you can also get it in most countries as a health food supplement. In other words, at a grocery store or a drugstore, it's available to you like many vitamins without prescription. We always recommend that people ask their doctor what's best for them, but actually the earlier in pregnancy you start choline and folic acid, the better their effects are going to be in how your baby's brain develops.
Thank you so much for time and sharing this knowledge. One of the things we're trying to do with the Her Story Circle is to make women aware of what is happening within their bodies. So we're looking for experts like yourself to bring an awareness to things that women can do to have better outcomes with their pregnancies. So let's just go back and unpack your story a little bit. Can you share what inspired your initial interest in psychiatry and pharmacology and how your path evolved throughout your career?
So I always knew that I was interested in the brain from a very early age. And when I discovered that as a psychiatrist, we could talk to people and try to understand something about their brains, I was excited by that. And I was also trained as a neurophysiologist. And so I was excited by understanding the way that nerve cells work. Most neurophysiology, of course, is done in animals because the brain is one of those things that we do not allow people to have access to most of the time. But the idea is that you could talk to a human being, a person like yourself, and find out how their brain was working was very exciting to me. And that you might be able to help them was even more exciting. As a neurophysiologist, I recognize that a lot of what we do for patients is just insufficient. And mental illness is important to be treated, and we recommend treatment, and treatments are helpful, but we're not curing people with mental illness. And so as a neurophysiologist, I decided to go back to the laboratory and see if we could improve on things.
Amazing work. So, how did your research at the Institute for Children's Mental Health contribute to the breakthroughs in understanding the genetic variants associated with these disorders?
So we developed a very simple test because one of the things neurophysiologists like are simple things. And we like to study something called inhibition. And I'll give you an example.
Mm-hmm.
Now, you and I both heard 2 claps.
Yes.
But if I were recording your brain or you were recording my brain and looking at the electrical activity, you would see that we responded to the first sound because we didn't expect it. And
Yes.
essentially, we used all our neurons to try to figure out what this guy is up to. By the time the second sound came, it was already repeated information, and your brain spent a lot less time thinking about it. People with mental illnesses generally respond to the first sound and to the second sound, and so they lack inhibition. And what we see is they're very easily distracted. They have problems focusing their attention. And sometimes they misinterpret sounds, and that leads to hearing voices, hallucinations, delusions that people are plotting against them, all because they're having problems in this very early sensory processing. And so I began to try to study its neurophysiology. And eventually, what we discovered, it was a very unusual type of receptor, a protein in the brain that wasn't working right. And when we traced the gene for that protein through families, we found that it also followed the pattern of inheritance of mental illness. So then the question was, could we improve things? Could we target a new treatment for that gene?
Yes.
One of the things we discovered was that patients already knew a lot about that gene because it could be activated by high doses of nicotine. And many people with mental illness are very heavy smokers or betel nut users, different compounds that use nicotine, but cigarettes are now unfortunately almost universal. Well, cigarettes aren't a very good treatment. They're not very healthy. They don't work very long. And so we tried to find for a number of years a better nicotine. And in the process, we tried to find out more about the gene. And as we were trying to find out more about the gene, the molecular biologist working with me said, I just got in a new sample of fetal brain, a piece of brain that a baby that had not made it to birth had left behind, and the mother had donated it to us. And I said, why are we looking in fetal brain? And she said, oh, everyone knows that genes work harder to build the brain than to work to operate the brain. So as incomparable as it is on how we operate the brain, it's even more difficult to understand how the brain is generated from a single cell without any external help from the mother. The egg and the sperm get together, and that is all the instruction the baby needs to make a brain. So we started looking at what our gene was doing during development, and it was being expressed at 10 times greater amounts before birth than after birth. So essentially, if we were trying to intervene after birth, the ball game was over already. We needed to begin before birth. Well, there are not a lot of things you can do before birth, but one of the things you can do is nutrients. And we had a little funny thing that our gene could be activated by choline, which is a natural nutrient. And the US Food and Drug Administration and regulatory bodies around the world said, go ahead and give it a try. And we did. And when we looked at babies whose mothers had taken extra choline during their pregnancy and nothing else had happened, 4 years later, these kids were better able to pay attention. They were more at ease with other children, and they had a much better relationship with their parents. And they were also less aggressive. So all of these things put them on a path to better mental health.
So how does prenatal choline specifically affect the risks of mental health conditions like schizophrenia and autism and attention deficit disorder?
So if we look at the brain of a person who has schizophrenia after they've died, so they've lived their whole life, we can go back and look at what happened to the molecules in that brain. And one of the things we discovered is that there's a final switch that's not turned on in their brain adequately. It's about half turned on, but it's not fully turned on. And they've lived like that their entire life. And that's the switch the choline turns on. Because the brain just doesn't get bigger as the baby gets bigger in its mother's uterus. It also reworks its brain a number of times. You can think about it like your first cell phone. It was pretty simple. You had a few buttons to push, you can make a call. Then it got upgraded and a little bit. And now, of course, you can do a million things. And you and I are talking over your cell phone right now. So, but it's not only has more memory than that first little push button, it also has upgraded its operating system probably about 15, 20 times. Wow. So the baby gets a new operating system about 6 or 7 times before the baby is born. And that last operating system requires choline.
So are there any side effects or challenges associated with prenatal choline supplementation?
The doses that we recommend are way below any toxic level. And people have taken up to 7 grams of choline without much problem. There is sweatiness. There are a few women who will have a problem in its digestion, and they'll begin to smell like fish. If that happens, there are things we can do to help that, and they're on my website, robertfriedmanmd.com. We can switch them to another form of choline that doesn't cause that problem. But in general, because it's a natural nutrient, it doesn't have side effects.
Okay. Oh, that's good to know. Now let's talk about some of your collaborations and case studies. Can you share your experience working with the Galvin family and how that case shaped your research into schizophrenia?
Yes, I'd be happy to. The Galvins are a family that lives in Colorado Springs, near Denver, Colorado. Mr. Galvin was a professor at the Air Force Academy, which is in Colorado Springs.
Right.
And they had 12 children, 10 boys and then 2 girls. And as improbable as that seems, of the 10 boys, 6 developed schizophrenia. And Mrs. Galvin, Mimi Galvin, who's the mother, was one of the first women to step forward and say, I'm not going to hide this. This is what's happened to my family. I'm making my family available for research. And so I helped treat some of the boys, and they also volunteered all of their genetic information, as well as their brains, for us to try to discover what was causing problems in the Galvin family. And they were one of the families that led to our discovery that this gene that choline we eventually found would activate was deficient.
That's incredible to have had such a challenge for one family, but for them to step up and help with the research. That's absolutely incredible. So how did Robert Kohler's book, The Hidden Valley Road, bring new public awareness to the struggles of families affected by schizophrenia?
I think Robert Kohler's book, Hidden Valley Road, really captured the imagination. People like Barack Obama and Oprah Winfrey put it on their favorite book list. And it helps not only to publicize what mental illness is all about and how terrible it is, but also it helped to publicize choline, because he spent a couple of chapters talking about it. The book ends in our laboratory with the research on choline. There are many books about the tragedy of mental illness, because mental illness is a tragedy. But every once in a while, a light goes on, and there's something we can do to help people prevent that tragedy.
That is so good. Now, how has your work with Brain and Behavior Research Foundation advanced public awareness of mental health prevention?
Well, one of the groups that we would like to really get help to are people around the world who are highly stressed. And the reason for that, and in our community here in the United States, it's African American women, Black women. Black women, more than any other single group in our country, with the possible exception of Native Americans. These two groups are very highly stressed. They face chronic problems with racism, discrimination, and we see that in their hair. So why do we look in hair? Because the stress hormone is cortisol, and cortisol gets taken up into the hair follicles. And so if we cut a specimen of hair from a woman, we can analyze it for cortisol and see what her cortisol level has been like over the last couple of weeks. And for African American Black women, we see that those cortisol levels are extremely high. Cortisol causes the woman to hold on to her own choline. So normally the woman eats choline while she's pregnant, and it goes into her bloodstream, and the placenta, the baby, is very good at absorbing and actually pumping that choline into the fetus. So fetal levels are higher than maternal levels normally. But if the mother's under stress, that all gets reversed. Then the mother holds the choline in her own liver, doesn't put it out into her bloodstream so the baby can't get it. The mother is fighting essentially for her own survival, and the
Yes.
baby is taking it on the ear. And as a result, the placenta doesn't develop well, the baby doesn't develop well, and these women are much more likely to deliver premature babies. Now, in our country and in your country, we like to think that all people are created equal. But babies who are born premature with their brains not fully formed aren't born equal to everyone else.
Uh-huh.
It's a terrible problem.
Yeah.
Turns out, though, if we can supplement these women's choline to get the levels high enough, they will develop their placenta despite their stress. They'll develop the baby, and their babies are born normally. Now, there are many barriers that highly stressed women have for health care. They have physicians who discriminate against them. They don't have resources. But what I feel particularly sorry for is when a woman overcomes all these barriers and makes it to her appointments, comes in on time, and still has a premature baby. And so
Right.
these women, we can give them extra choline and try to increase the chances that they're going to have their baby healthy and on time and equal with all the other babies.
So how do you think public understanding of maternal health influence on children's futures has evolved over the recent years?
Well, I think it's a struggle. It took 10 years for people to accept that folic acid could help spinal cord problems. That means 10 years where women were delivering babies with preventable spinal cord problems. We're just starting with choline, and there are a number of people advocating for it, but it's not universally recommended to all women right now. And that's why I'm grateful to you for this chance to speak to more women, because choline as a natural nutrient doesn't command the kind of advertising and advocacy that expensive drugs do. And so
Yes.
essentially, you're our drug company ad for us. You're the one who's helping us reach more women because we don't have a drug company that's funding a large public outreach campaign. It turns out drug companies do make choline, but they see it as a low profit item. But it's a very profitable item for the woman who takes it.
Every day. Yeah, who really needs it. So looking to the future, what are the next steps for research on prenatal interventions in mental health? And what promising areas are you exploring now?
So we're still spending most of our time on choline, and we're interested. We have women who were exposed to both to COVID and also got choline supplements. We want to see if we know that choline will help when women are exposed to other viruses, but we don't know specifically about COVID-19. We'd like, as COVID-19 is not going away, we'd like to see if it's going to be protective. It turns out by biology coincidence that the receptor for marijuana, cannabis, and the receptor for choline are on those same neurons that control the inhibition. And we know that women who take marijuana during pregnancy in the mistaken belief that it'll help their morning sickness do have babies who have a lot more brain problems. We want to see if choline will help those babies. So there's lots of work to be done. We're still working on getting just the dose right and the timing. And so that's been our work. We're also hopeful that other researchers may find other nutrients that are helpful. There are researchers working on vitamin D, for example, and just what the right level should be. And dark-skinned people, particularly dark-skinned people who move to northern climates, have a lot more problem getting vitamin D because their skins don't absorb the sunlight when it comes in only a brief period. Those Nordic ladies with the fair skin can do it. Of course, they have other problems when they move to the tropics. So migration is something that we think we have to pay attention to as well.
So how can psychiatrists and mental health professionals integrate findings from genetic and prenatal research into their everyday practices?
We, of course, see a lot of mentally ill women, and we try to make sure that when they get pregnant, that we can get them on choline as soon as possible. But psychiatrists don't deliver babies, so we have an
Yes.
obstetrician on our team, and she's
Okay.
working with her obstetrical colleagues, and we're working with our family medicine colleagues and the midwives. So we really want to get to the people who deliver babies, because those
Yes.
are the people that women naturally turn to for their advice.
For families of children already diagnosed with mental health conditions, are there emerging treatments or interventions that you particularly are hopeful about?
Yes, I think particularly what we find is that drug treatments we use judiciously with children, but they are helpful. And they're helpful for allowing children to control their symptoms. So we recommend that children who are having trouble in school, that they contact a mental health professional about whether a stimulant would work. There are a number
Okay.
of children who get psychotic early in life, and they are helped by antipsychotic drugs. But these drugs, the drugs we have as psychiatrists, aren't preventative. They simply help manage symptoms. I found that children who also are made aware of what mental health professionals can do in terms of counseling are often better able to seek help as soon as they need it. For example, children who've had a very early contact with a mental health professional, should they get sicker later in life, are much less likely to commit suicide, because they know that they can go back to a mental health professional for more help.
Yes.
Also, we can help families, and the children in the family who are not mentally ill also need help, because a lot of attention is placed on the mentally ill child.
Yes. Well, it's a challenge. So, how do you envisage the role of preventative medicine, preventative mental health measures in healthcare policy, particularly for prenatal and early childhood care?
Well, healthcare policy is the last thing to change. But we
Mm,
have had some success in Colorado. In my country, United States, 40% of the women are on a program called Medicaid,
yes.
which pays for their delivery. Choline is not covered as a prenatal vitamin. Choline isn't particularly expensive for US women. It's about a little under $200 a pregnancy. But
Okay.
$200 US dollars is a lot of money for some women. And to get $200 for choline is just beyond their capability. So Colorado now covers Medicaid prescriptions for choline.
Okay.
And we're trying to get more large pharmaceutical companies to register with Medicaid to try to get choline available to as many women as possible through Medicaid programs. I think the US will lead the way. The World Health Organization is still furthest behind, but the FDA
Right.
has already increased its recommendations for choline, and we're hopeful that if this goes nationwide in the US, it may go to other countries as well.
We'll go global. So, mental health awareness has grown significantly in recent years. What changes in public perception have you observed, and what areas still need to have more focus?
I think people are accepting that mental illness needs its share of funding, that we
Yeah.
have to treat mental illness, because the mentally ill people among us are among us, and we
Yes.
want to live with them, and they live with us. And so, but it's still a we and they. Mentally ill people are still, even if they're not shunned, they're not treated the same as other people. So prevention is really very important, because if we can prevent someone from being mentally ill at all, that's the
It's the
best
best.
we have.
So, my final question for you is, what legacy do you hope to leave in the field of psychiatry? And what advice would you offer the next generation of mental health researchers and practitioners?
So my legacy is all these healthy children that I see coming through our laboratory who've had choline. I'm excited about them.
Yeah.
But I'm also excited about the people we've trained. And I hope that other psychiatrists will say, okay, if we can get one nutrient to work, can we get others? And we were looking at one particular small piece of neurophysiology. And
Right.
it's like having a microscope. We went and peered down as close as we could. But when we
Yes.
did that, we lost the field of view. We didn't see the whole problem. So
Right.
I would like other people to take their microscope and go into a different area and see what they
Yes.
find. And finally, the other thing I tell women, because women talk to women, is that your child's going to go to school with other children. You want
Yes.
your child to pay attention. You want your child to have friends. But who are these friends going to be? You want them to pay attention. You want them to have friends. And if everyone is healthy, it's a much better classroom.
Yeah, that is so true.
Women should tell women, and hopefully it will spread through the social network of women around the world.
Yes. Absolutely love it. Well, thank you so much for coming online and empowering us with this knowledge. I'm so glad that I'm being able to, broadcast your message to this part of the world here in Australasia. And thank you to everybody who's tuned in. So the Her Story Circle is a platform that brings you the knowledge and voices and stories of people from all over the world, men and women, with a focus to improve women's lives in whatever way. So tune in again tomorrow when I focus on yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world, and bye for now. And Dr. Freeman, thank you so much for the interview. Thank you for tuning into the Her Story Circle podcast. I hope today's story has inspired you to believe in the power of our stories and the difference you can make in the world when you use your voice. I'm Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a rich tapestry of diverse perspectives. Don't forget to subscribe, rate, and review our podcast to help us share these stories with more listeners. Follow us on social media by looking for the Her Story Circle podcast for more updates. And join us tomorrow for another episode filled with courage, resilience, and empowerment. Remember, your story matters, and together we're building a stronger, more inclusive world. Until next time, keep making her story.